My name is Fernando Espi Forcen, and I am a psychiatrist working at McLean Hospital at the Division of Depression and Anxiety Disorders. We're going to be talking with my colleague Albert Yoon about ketamine-assisted psychotherapy, which is the use of ketamine as a enhancer of the psychotherapeutic experience. So this is opposed to classical ketamine treatment, which involves using the medicine for healing. Here, what we propose is like the ketamine as a substance is used as an enhancer to psychotherapy, and we integrate the psychotherapy together with the ketamine. Therefore, patients won't understand the use of ketamine just for depression, but they will use ketamine associated with psychotherapy. They won't see ketamine, as a single monotherapy. The combination will be the treatment. I think the key takeaway is like ketamine can be given as an antidepressant, and it really helps depression. But in ketamine-assisted psychotherapy, what you're trying is to gain insight, because ketamine is also an atypical dissociative psychedelic. Doesn't work like the traditional psychedelics, but also allows for your conscious mind to loosen, and then you can have some new insights, and more understanding of yourself. So using ketamine not only as an antidepressant, but as an opportunity to learn about yourself and to have more insights and understanding of oneself, and something you can integrate with your therapist, will be the key and the focus of ketamine-assisted psychotherapy. Yes, I think that we don't know what is going to happen, but psychedelics are being decriminalized in most counties and states, and they are being approved for treatment in some states, and soon they will be approved nationally, especially with the recent presidential executive order to do more research on psychedelics. I think it will help the field, and it will help the field of ketamine-assisted psychotherapy, because more people will be more open to the idea of ketamine-assisted psychotherapy or the psychedelic psychotherapy model for ketamine, rather than seeing the classical orthodox ketamine monotherapy without psychotherapy, which we have seen in medicine and in psychiatry. So I think it will add more awareness, and it will improve an opportunity for people to think about it. And in particular, in psychedelic-assisted psychotherapy, when you use psilocybin or LSD, the treatment, or MDMA, the treatment lasts for 6 hours to up to 10 hours sometimes. And in ketamine-assisted psychotherapy, the treatment is about 2 hours. So I think people will see this as a way of giving psychedelic-assisted psychotherapy in a clinic in a more pragmatic way that will work for the regular schedule of a psychiatrist. I think both. People have that debate all the time. I don't think they compete with each other. So I agree that psychedelics shouldn't be criminalized. I don't think psychedelics should be punished or restricted, but I think people should be educated and say, well, why psychedelics shouldn't be criminalized. Also, you get your better chance of recovering if you do it in a clinical setting with people who have been informed. But there are a lot of debates about what kind of psychotherapy, what kind of psychotherapy model are we implementing, what is practical, and there is a lot of discussion about it. But I think overall, psychedelics are bringing a new layer in psychiatry I think in psychiatry was a vacuum of psychological theory and spirituality, and the APA was not integrating or doing enough to integrate this, ontology, philosophy, spirituality, and psychedelics are bringing back to the table. And psychiatry, instead of going to this purely biological, physically reductionist model that is, for the new generations was not that exciting. Psychedelics are now saying, no, now we need to think about the spirituality, we need to think about transpersonal psychiatry, we need to think about all this, and it's bringing up to the mainstream table. And APA and psychiatry are thinking, that's the way to go. So I think, society is on board with this, psychiatry is on board with this, medicine is on board with this, and I think nobody should compete with each other, because this is a good thing that everybody is agreeing that this is a good idea. Yes, my recent research and another talk I'm doing here is studying psilocybin, and not only psilocybin-assisted psychotherapy and psilocybin pharmacological interactions, which is something I've been doing some research. I've been interested in psilocybin systemic effects and how psilocybin can impact overall health, and how psilocybin can expand lifespan and delay aging. So part of my research and my future research is focusing on how psilocybin in translational studies could potentially expand delay aging and expand fertility lifespan. So I want to study psilocybin effects on fertility. We know it helps depression, we know it helps psychotherapy, but I want to study psilocybin effects on fertility.